Hey there, it's Dr. Tom with EBM Fitness Solutions, and I'm going to break down low back pain and deadlifting. Reasons why you might be having the pain. It could be based on the type of deadlift you're doing, ways to modify those things, why deadlifting is even important to work on, why you should care. We're also going to kind of talk a little bit about the back pain itself and things you can do to kind of remedy that, but understand that back pain is tricky. It's oftentimes, there's a lot of things that are kind of interconnected that are causing the pain. So this video is not going to directly manage your low back pain, but understand it takes a long time. You have to focus on a lot of different things, and it's never going to progress as fast as you want it to. But the good news is, if you're willing to make some changes and you're willing to give it some time, you can ultimately manage and then resolve the back pain that you're dealing with. These steps here are geared more towards deadlifting, but they can be applied to some general overall strategies. So this video series is going to break down a lot of those components about why you're having back pain with deadlifting, why it's important, and then show you how to modify some of the more common variations of the deadlift. So why should you bother trying to deadlift if you're not deadlifting, or why should you bother trying to modify your technique if you're already doing it and maybe it's causing you some pain? Other than the fact that deadlifts are awesome, it's actually how you should be picking things up in general. When you bend down to pick something up, the deadlifting technique is the way you really want to do it. A lot of times people will say, oh, keep your back straight when you lift, which is actually horrible advice. I think I understand why people tend to give that advice, because they keeping your back straight and you try to lift this here. This, unfortunately, that's a terrible position to lift anything from. Never mind anything that's heavy, but it's not the best way to lift. Now, sometimes you have no choice. If you're picking up a desk and sometimes you're moving furniture, you have no real way to get into a deadlifting position. But generally speaking, when you pick stuff up, you want to pick it up more with a deadlifting type technique. Well, the heck am I talking about? So check out the video here. This is using a straight bar, and even if you use other variations, the technique generally speaking is the same. A lot of hip motion, a little bit of knee bend, but not much. And you see that the upper body, my torso, I'm leaning forward. We're going to talk more about that, but I'm actually hinging at my hips, so my spine actually is not bending at all. That's the trick with deadlifting, is learning how to hinge here and make the motion primarily come through the hip joint and not much at the knees, very little at the spine at all. So the idea of lift with your knees, otherwise you hurt your back, or keep your back straight when you lift. People are saying that, I think, with the best of intentions. However, when you actually break down how the body moves and what the deadlift actually does, those cues and that advice is horrible. Deadlifting, when done properly, is very safe, and you can actually lift very, very heavy weight from that position once you learn how to master all the little pieces that go into it, which we're going to talk about in the coming videos. One of the most common reasons people have low back pain with deadlifting, and actually a lot of things in general, is actually ab weakness and kind of the inability to really engage them properly at the right time. So when we're talking about abs in this example, we're talking about them as stabilizers, not creating a crunching motion or bending and twisting, which they do. It's more about not moving or resisting motion. That's really the key here. So when you think about your abs as stabilizers, when we're going to talk about bracing, the easiest way to kind of make sense of it is to think about getting punched in the stomach. If somebody was going to come up and they were going to whack you in the stomach, you would just reflexively tighten everything up here before you got hit. That's kind of what we're talking about. There's more to it than that, and I won't go too far off on that tangent because it's a whole separate topic here, but the idea is you have to understand how to get your low back, A, into a good position, and then B, how to stabilize it, and then C, to stabilize it while you're moving. That's the key. Some people can actually get into a good position, lock everything in tight, but then as soon as they move, it falls apart. And then that's when they get hit with pain. Sometimes it happens towards the end of a set with fatigue, so they might be okay for the first few reps, and then it breaks down after that. But the key really is to learn how to get your back into a good position and how to stabilize that position, both statically, meaning when you're just standing like this or getting set up, but then when you actually go to lift, whether it's the actual deadlift exercise or just picking something up around the house, you have to be able to maintain that stability and that that bracing idea as you lift, not just when you sit up and then you kind of let it go. It has to be maintained all the way through. There are some great exercises to work on that can help you start that technique. But the thing with core stability and building up your abs and stabilizers is you're probably going to have to spend time working on those separately in addition to as you're deadlifting. And it may even require you spending more time doing it away from the deadlift, and then you make some of the modifications with the variations we're going to talk about later. You work on the core stability, you change the type of deadlift you do to help kind of tie all the stuff together, and then you bring it back to where you are currently or where you want to be as far as whether you lift with a trap bar or the straight bar or things like that. Oftentimes when people have pain in their low backs with deadlifting, or even just in general, one of the biggest issues and one of the hardest things to correct is the ability to hinge at the hips and not just immediately bend the spine when you go to move. What do I mean? So check out the video here. I have a dowel, basically a stick on my back, to show that as I bend at the hips, my spine position doesn't change. The dowel touches the same spots at the top of the motion as it does at the bottom of the motion, and that is the goal of the hip hinge, that essentially you pivot through the hip joint, and then everything above just stays locked in as you move. That is the key with learning how to deadlift. And to be perfectly candid, with most lower body exercises and movements that you're going to do when your feet are on the ground, okay? So if you think about climbing stairs or doing a step exercise, if you think about like a lunge exercise, squats, deadlifts, you name it, basic sitting and standing, right? All those things are going to incorporate some sort of a hip hinge. They have to. Unfortunately, most people, especially people that have low back pain, don't hinge at all. They're very terrible at it. And it seems like such a simple idea, like, well, just push your hips back. And trust me when I say, it is not that simple. I've spent weeks and months with clients and patients helping them learn how to hinge. It sounds ridiculous, but here's the thing though, if you can't do it in a simple sort of supported position, then you have a 0% chance of doing it when you deadlift. So what do I mean? So check out this. This is bridging, right? Simple. You're basically, you're lifting your hips and your butt up off the ground, but essentially you are hip hinging. It's a different variation of it, but from the hip perspective, it's no different, right? When you're laying down, your hip is flexed, you're moving into an extended position. When you deadlift, your hips are flexed, you're moving into an extended position. It's no different, right? The point is, if you cannot do a bridge properly with feeling it in your butt and not feeling your hamstrings, not feeling your low back, if you can't do that through a full range of motion, you are never going to be able to deadlift or do those other lower body things without problems. You have to master the basics, and then you can bring that forward to other things. So when learning how to hip hinge, this actually ties in nicely with the previous video about core stability. These two things work really well together, because what happens is when most people go to hinge at their hip, they move right into their low back, right? So when you brace your abs, it stabilizes your back, okay? So that's one. And then when you go to move at your hips, it allows everything to stay in the same position throughout the motion. That's how they kind of work together. What most people do, and this is this is what I've seen, so maybe it's slightly more anecdotal, but over the years, people that have chronic low back pain issues hinge very poorly at their hips, and oftentimes they don't know how to stabilize or brace their abs at the same time. So you've got two things working against the low back. So we have to work on those two things, again, separately, then bring them together, and then bring them to the deadlift. But they have to be addressed. If you just kind of blow past those things and think that, oh, I'll figure it out on the fly, you won't. You have to come back and work slowly and be more methodical through this process to make sure that you can do things in an easy position, right? So again, here's the bridging again. I also love pull-throughs and then some kettlebell taps. These are all great ways to introduce and reinforce good, positive hip hinging with good core stability. And the nice thing about each of these is they're going to transition nicely into your deadlift technique, which we're gonna start to talk about soon in terms of what are some ways you can do it, how do you modify doing it, and then also, if your back is hurting, should you deadlift? which kind to do. There's different things you can look at when it comes to those things, but you have to improve your hip hinge if you have any chance of getting out of pain when you're deadlifting. So if your back is hurting, should you even be deadlifting? It's a great question. And the answer, unfortunately, is, well, it sort of kind of depends, okay? The first thing with this example, if you're having what's known as referred pain, meaning that the pain is into your butt or down into your leg, no, you are not deadlifting. You should not be doing much exercise unless you've been evaluated by a skilled clinician to figure out what the heck's going on. Because if you're having pain that goes down the leg, even just into the butt a little bit, you're compressing a nerve. And you have to be very careful with it. It doesn't mean that you can't do things, but you need to know what's going on and what you can get away with. So if you're having nerve compression, I would say, generally speaking, this information is not for you. You need to go get evaluated by somebody who knows what they're doing. And listen, if you're local to EBM, I'm located in Danvers, Mass. Reach out to me, come on in for an evaluation. We can check things out and see what's going on. But the key is you want to be very careful with that, because it's very easy to make nerve stuff worse. So if you have pain going down the leg, then no, you should not be deadlifting. You should go get evaluated. Now, if you have pain that's kind of in the low back area, could be one side, could be both sides, could be kind of in that area, but generally speaking, it stays in that area, then we have something we can work with here. So if you look at pain on a pain scale, which is obviously very subjective, but 0 is I have no pain, and then 10 is the worst thing ever. And real quick, if you have 10 out of 10 pain, you cannot verbalize you have 10 out of 10 pain, okay? So if your pain is up there, you can't look at me with a calm face and say you're 10 out of 10 pain. That's not how that works, okay? If you're 10, you're screaming and you're in so much pain, you can't actually utter the fact that you're in 10 out of 10 pain. But if your pain is low, 3 to 4 out of 10, as far as what you perceive, and it's there, then okay, it's low enough so we could potentially look at deadlifting or doing some kind of a movement. Now the key though, and this is where how we sort of, with pain gets a little messy. It's not an all or none. It's not like if you have pain, don't do it. Because when you're rehabbing an injury, there is a certain amount of discomfort you're going to have to work through, but it's a very slippery slope. 3 to 4 out of 10 pain, so it's on the lower end. The pain cannot get worse. If it gets worse, you have to stop immediately. That's it, done. A lot of times, if you have some discomfort and you're doing a movement, but your pain just stays right where it is, then the movement that you're doing isn't directly irritating the problem, and it's relatively safe to do, okay? Big, huge gray area there, I get it, but that's something that I've used with a lot of clients and patients, because if you never have them do anything with discomfort, it's gonna make it very difficult for them to progress. But you can't allow the pain to increase every time you do something, because that's directly irritating. You're basically poking the thing every single time. That's going to delay your healing. So the key is, if you can do the motion and the pain stays, great. Sometimes the pain will actually improve. It decreases as you get moving, which is a great sign. Okay, that means the movement is actually helping it get better, so that's great. So it sort of kind of depends. Now, we're going to talk about in the coming videos types of deadlifts and how to modify them. That's going to be really the key here, is you're going to have to modify what you're doing. And it might mean changing the variation. If you're doing a bar, go to the trap bar. If you're doing a trap bar, maybe go to kettlebells, and maybe elevate the deadlift. Not everybody is meant to pull from the floor. I know that sounds kind of crazy, but sometimes elevating your deadlift a little bit is a great way to take stress off your back, especially if there are hip mobility issues or other things going on. So the key really is find a way to make it easier, because what we're trying to do, oftentimes we need to minimize irritation to the back while we're kind of doing what we're doing. Usually we have to also work on some of the hip hinging technique things and the core stability stuff. So you're working on multiple things at the same time while you're trying to keep pain down. It doesn't make sense to just keep hammering the same type of deadlift you've always been doing, right? Make it a little bit easier. Elevate what you're doing, or go to a different version for a little while so that you don't have to be in pain. And that will also allow you to connect all the dots here, right? So then you have your core stability, your hip hinge, and your pain's going down, so you're reinforcing good movement patterns. It's very complicated, but that's the approach you really should be taking, is initially make it easier so that it doesn't hurt, work on your mechanics and tie all those things together, and then you can get back to doing the variation or the version that you were doing before when you had the pain, but when you get back to it, the pain should now be gone. Next, I want to talk to you about one of my favorite ways for teaching people how to deadlift properly if they've never done it, but also how to introduce the movement when somebody has low back pain and they're used to doing it other ways, but we need to show them how to do it right and help get them out of pain. And it's using the kettlebell. So kettlebell deadlifts are awesome, but you can see I have it elevated. I referenced this in the previous video that sometimes you have to elevate your deadlift, right? Not everybody should lift from the floor. And this is true. So if you're taller, it's probably more, it's something you have to consider more because of the length of your legs, and getting all the way on the floor might just be too much. But if you have pain, you may also have hip mobility issues where your hips don't move as well as they should, which means when we talk about hip hinging, well, if the hips get stuck, the next thing to move is the back. So even if you're not, 6'5", you may still have issues deadlifting because of other mobility issues. So one of the easiest things you can do is put the kettlebell on a step, because this is it's a blue step, in case you weren't sure of that. It's actually a 6-inch step is what I was gonna say. But for other people, I've used 2 of these. So I've had a 12-inch step, or I have this and the other one that I have, which makes a 10-inch step, because for some people, the progression is taking one of the steps away and lowering it down. The weight can actually stay the same, but we lower it down so they work through more hip range of motion while keeping their abs tight. So this is fantastic. If you've never deadlifted before and you want to start, kettlebell from a box is amazing. And if you're having pain with other types of deadlifting, or if you're doing the kettlebell from the floor, throw it up on a step and try it that way. Now, the other thing that I will often do for people that are having low back pain is what I call kettlebell taps, which is basically you're going through the deadlift motion, but you're just coming down and tapping the kettlebell with your hands, and then you're coming back up. When you set up for either the lift or the taps, your feet should be on basically on the sides. You should sandwich in the kettlebell, if you will. So I don't want to stand this way, because what I've done, I'm increasing the horizontal distance from where my body is to where that kettlebell is. I want to minimize that, so I want to be right over the top of this thing. That's one of the mistakes people make. They get the thing too far out in front, then they can't hinge, because as they push back, well, they have to come forward to get the weight, and it throws off their technique. So get your feet on either side of the kettlebell. Okay, now what most people do in general, but especially when people have back pain, is the first thing they do is they bend their knees. That's no good, right? A kettlebell, because it sticks up pretty high, plus the step, you shouldn't have to bend your knees at all. You should be able to go through the hips completely and tap the kettlebell and eventually lift it. So from here, what I want to do is push my hips back, tap, come back up. I know it looks ridiculously simple, but if you're having back pain, then you're apprehensive, you're going to be tense, you're not going to want to do, the idea of getting into this position when you have back pain, it seems scary. It seems like it's going to hurt your back more, so you will fight it. People, they'll go here and then they kind of end up doing one of these. So it takes time to reinforce the proper movement. But if you can get in the habit of doing this, maybe you 3 to 5 reps, right? So you set up, come down, tap, back up, tap, and you just work on the taps. Don't even lift, not yet. You start with the taps. If you can do taps without pain, great. But if you're still having pain with the taps, then you don't qualify to move on to lifting it. Work on the taps, work on your core stability, work on your hip hinge. But the taps are awesome. And a lot of times what I'll do with people is have them do 3 to 5 taps and then 3 to 5 actual lifts. Again, the volume stays lower. When you have pain, your rep scheme and your approach has to change. Doing 12 reps in a row, not a good idea. Work on maybe clusters, right? So maybe you do 3, 3, 3, 3 to get your 12 or something like that. But your volume typically has to change a little bit. Your approach to reps has to change a little bit. And that's, people, they miss that part of it. They just lighten the weight. They keep doing high reps or what their normal routine with lighter weight and still crappy technique, and then they wonder why they're still in pain. It's not that mysterious. So again, after you do the taps, what you want to work on is actually lifting. So you get your hips back and you lift. But when I come down, I pause, but I don't let go, and I don't relax. Keep all your muscles tense, and you lift again. When you deadlift, whether it's kettlebell or any of the other variations we're going to talk about, you're not lifting with the arms. You're lifting with your hips and your glutes, your butt muscles. You're hanging on here, obviously, but I'm not pulling the kettlebell. I'm holding on, and by me straightening my hips, I lift the weight up, right? So think about that. You're not actively necessarily pulling with the arms. You're holding on, and you are engaging the upper body, and it's a total body exercise, but the lift comes from here, the hips and your butt. Focus on that. The cue that I often give people when learning how to hinge when they're standing up is heels and hips, right? So from here, my feet are flat, dig your heels in, push back through your hips. Make it all about heels and hips. If your weight is shifting onto the midfoot or your toes, that's incorrect. It's going to make it very difficult to hinge back while you're up on your toes. So dig your heels in, heels and hips. Sit back through it on the way down, push your heels in and squeeze your butt coming forward on the way back up. Heels and hips. Start with kettlebell taps. It doesn't even matter how much weight's on there. Just put it on a step, put a weight down. If you don't have kettlebells, stand a dumbbell up on its end. Do the same thing. Put it on the step, come down, tap, and then come back up. But this is a great place to start. If you've never deadlifted before and want to get into it, this is a great way to start. If you're having back pain, this is where I would come back to and start the journey here. Make sure your hip hinge, your core stability are good, but this one's the key, and then we can work through some of the other variations we'll talk about next. So now I'd like to talk to you about one of my favorite ways to deadlift, and that's using the trap bar. So if you're not familiar, and if you can't get a good visual to here, check out the picture here. It's a trap bar. Okay, so you basically step into the thing. The nice thing about this, compared to the straight bar, which will be the next video we're going to talk about, is that it allows your hands to stay in a much more, your hands and your shoulders in a more of a neutral position, which is nice. So the one downside, if you will, to the trap bar, because of its shape and because you can step inside it, is that people tend to squat the weight up. Okay, so with deadlifting, it's primarily a hip motion with a little bit of knee bend. But in the bottom position, you should be looking towards the floor, okay? So if I bend down here, right, I'm gonna be lifting from this position here, right? So this is a deadlift position. If I squat, it's this way. So my chest is up more. Because of the shape of this, as the weight gets heavier, people end up getting into it and they squat the weight up versus actually doing a deadlift. So it is something to keep in mind that if you use a trap bar, make sure that it's an actual deadlift and not actually a squatting exercise. So the technique is really no different than what we just talked about with the kettlebell from the box, or even if you're doing kettlebell from the floor, it's the same basic motion, right? So I'm gonna step into the trap bar, and then I'm gonna grab the handles, but I'm gonna focus on getting hips back, head down, everything is tight, abs are tight, upper back is tight, dig my heels in, lift. Now from here, I don't bend my knees, I push my hips back, pause, make sure you pause, you don't want to bounce, get down, pause for a second, but stay tight, lift, okay? Trap bar deadlifting is great. For most of my clients who have had low back pain, who kind of want something a little bit more than the kettlebells, we'll go from the kettlebell taps to the kettlebell lift to the trap bar deadlift. Now, again, some people, I have progressed people who still don't lift from the floor. So check out this picture here. This is a way you can elevate your trap bar to still allow a person to lift, but allow them to stay in a good position with their hips and their low back, because forcing somebody to go further than they can go with an exercise is just tempting fate. You're just asking for something to go wrong. And there's nothing wrong with, in the picture, I had a couple of 4-inch steps I flipped upside down, set the bar in that, the person can lift, they can lift without pain, and we can slowly progress that weight up there. Because when we take the steps away, you can watch the low back start to kind of move a little bit. And for somebody who has chronic low back pain, there's no reason to do that. There's no rule, there's anyone that says you can't lift from a slightly elevated position. So if you're having back pain and you've progressed from the kettlebells and you want to move on to the trap bar, it's okay to throw something underneath the trap bar to elevate it just a little bit to allow you to kind of progress the overall deadlifting technique while keeping your pain low or zero. Now we're going to talk about the granddaddy of deadlifts, and this is the kind of deadlift that when people talk about deadlifts, this is most commonly what they're referring to is using a straight bar to deadlift. It's a good exercise, nothing wrong with it, but if you're having low back pain and back issues, then this is probably not the best option for you. There's other technique demands that are different than both the kettlebell deadlift and the trap bar deadlift. And I know some bros out there, this is basically the only way to deadlift. And hey, that's cool, man. If you want to jack up your low back, be my guest. But if you're doing it and you're noticing that you're having chronic issues with it, make the change. It's only going to help you, not hurt you. And you can still lift a lot of weight with a trap bar. You can still do those things and not be in pain, which to me sounds like a pretty good deal. So with the straight bar, a couple different things that we have to consider and look at that are different than both the kettlebell and the trap bar. And the first thing is obviously the bar is straight, right? But with that, you cannot squat the weight up here, okay? With the trap bar, because of its shape, if your knees go forward a little bit, no big deal. Your knees go forward on this thing, one of two things happens. Either the bar drags up and smashes your shins on the way up, which hurts, and is also not the right way to do it. That's not some kind of weird badge of honor. It means you messed up, basically. So that's not good. The other thing that happens that if I'm trying to lift this bar and my knees get in the way, well, now I gotta move the bar around my knees to lift up. Remember back in the kettlebell video, I talked about decreasing the horizontal distance between me and the weight. Well, if I come up here and I gotta move this thing out, I'm increasing that horizontal distance, usually with a lot of weight on the bar too. So that is not great for the back. As the weight moves away from the knees, it tends to pull your weight off your heels, which will also tend to round your back. No good. None of that is any good. So that's where a lot of people jack up their deadlift, is that their knees come forward and then they have to move the bar around that. So that's the thing. Basically, your knees from here, and I'll show you in a second with the bar, but when I lift, my knees should kind of come back out of the way, right? So the path of the bar is vertical, straight up and down. It shouldn't be doing any kind of funny business. It's vertical, it's up and down, that's it. So that makes this version a little bit more challenging because you really have to have a good hip hinge. You really have to have a good understanding about how to do that. So what you want is when you set up here, right? So the first part of my motion is going to be driving back this way, not pushing forward, right? If you're chronically bashing your shin against the bar, not okay. You're doing it wrong. Fix that. Otherwise, you're always going to have problems. Or maybe just try a different version. Or maybe you need to really go back to the basics and improve your hip hinge and improve those other things. But what you should be able to do is you grab the bar up, and then heels and hips on the way down. Same idea. When you get to the bottom, pause, but keep everything tight, and then lift. Try not to bounce. And with deadlifts, something to consider is one less, not one more for reps, okay? So deadlifts are challenging. It's a total body exercise, pretty much works the entire back of your body from the shoulders right down to your feet, okay? So there's a lot going on there. As you progress through, as you're getting towards the end of your set where you feel like you did a certain rep and you got up there and you struggled, but you got it, that's probably a good place to stop. Especially if you're working on rehabbing an injury, don't do that one more where you're going to gear up. Because here's the thing. Say you've done 6 solid reps, and I'm going to get one more. Well, that 7th rep is not going to be better than the 6th one. It's going to look worse. It's going to be uglier than the 6th one. Do yourself a favor, because that one rep is not going to vault you that much further ahead, but you're opening yourself up to injuring the back or tweaking something else, and it will knock you backwards for sure if you get careless. So with deadlifts, I usually encourage people to do one less, not one more, especially when you're coming back from pain. Now, how do you modify the deadlift? So you can do a very similar thing. You can put it up on some boxes or step. You can also do a rack pull. So check out this video here. Basically, you set up on a squat rack. In my video, to get the appropriate height, I put it on the safety bars, but then I actually stand on a 4-inch step. That, to me, for my setup here, it gets me in the right position for where I want to be. Depending on where you're doing it, you may be able to pull from the floor and have the bars on the rack, and that'll be fine. But make sure you adjust accordingly so you have the proper setup for you. One other consideration when you're working with a straight bar, and if you're dealing with any kind of low back issue, is that oftentimes when people lift with a straight bar, they use kind of a mixed grip where one palm is facing back, one palm is facing forward. This grip, without question, does allow you to hold on to much heavier weight than if you have both hands kind of overhand this way. So there's nothing wrong with that, but something to consider so we have what's called a carrying angle of the elbow. And sometimes when you get set up this way, this can kind of almost push the knee a little bit in, and that's going to create issues up the leg into the hip, and the hip and the low back are linked. When one moves, the other moves. So something just to be mindful of, that as you're setting up, be mindful that if that elbow is pushing right against your knee, when you go to lift, you could actually be creating a little bit of a problem that is not going to help you as far as lifting more weight. It's going to put a ton of stress on both the knee, the low back, and it's going to make it tough, and harder to kind of get into the hips and use the glutes. So something just to keep in mind if you like the mixed grip, and if you are going heavier, as you're kind of warming up and going through some lighter sets, it may be worth switching your grip periodically, set by set, to kind of work both sides. But watch that elbow kind of pushing the knee in a little bit, because it might be something, it's subtle, and it might be happening, you may not be aware of it, but it's something that you should pay attention to as you're getting yourself set up. And if you're noticing that you can't really control that, that might be an indicator to kind of switch over and work with the trap bar a little bit more and see if you notice an improvement. One of the first things I mentioned in this video series was the fact that deadlifting is really how you want to lift things up in general. And that is very true. But there are always kind of exceptions to the rule. And here's the thing. If I have to pick something up that's very light and very small off the floor, say the little clicker I use to turn my video thing on and off, if I gotta pick that thing up, sure, I can deadlift down, but what's gonna be a little bit easier is if I do what's called a golfer's lift. If you've ever watched golf or play golf, you notice that oftentimes when the golfer goes to pick up their ball, they put their club in the ground, and then they kind of do something like that. So the golfer's lift is actually an exercise you can do as well. It's called the single leg Romanian deadlift. I don't make up these names, that's just what it's called. So it's a great alternative, and especially when your back is hurting, not so much as an exercise at this point, but as a way to kind of get through your day and to bend down to pick up things that are light and very, very close to the floor. A little clicker, a pen, your phone, your keys, something like that. And obviously you're probably not going to carry around a foam roller with you every day. It would be pretty cool if you did, but I'm guessing you don't. But use something close by, right? So if the couch is there, hold on to the couch, put your hand on a wall, chair, whatever. You can, in a pinch, if you don't have anything, put your hand on your leg, kind of come down that way. And as I did that, I tapped my back foot down. It still allows my hips to move a little bit differently than when I have both my feet this way. I can do this, but for getting to the floor, this might be a better option. Remember, one of the modifications we talked about was elevating your deadlift. That going all the way or kind of lifting from the floor is not always the best way. So this is a great alternative to kind of working around that. Using something for balance, it makes getting to the floor much easier, puts much less stress on my back because my hips are kind of free to move in a different way than when I have both my feet on the ground. So keep this in mind, both as a daily activity, sort of helper, if you will, and then eventually it can be a really great exercise that can be done, getting body weight without support. I like the support with this one because again, you're standing on one leg, so balance now becomes an issue. So if you're doing the exercise and you're kind of the whole time you're doing this, that's not helpful. You're not getting stronger. You're more likely to tweak something. Whereas if I put my fingertips on the foam roller, so not pressing my hand on my fingertips, then I can go through the motion and my muscles are still working. My hamstrings are getting a good work here. My abs are still bracing, but just the fingertip pressure here, it helps to stabilize me from a balance perspective. So that way I'm not all over the place. So if you are doing this exercise, because here's the cool thing about that. If I'm on my left leg, I can put my right hand on this and I can still hold a dumbbell or a kettlebell or whatever, and I can still load up this exercise and still use this for balance. Nothing wrong with it. It's not cheating, because again, you doing this, I mean, I don't even know what that is, but it's not helping you at all. So if having a little bit of fingertip pressure on the roller helps with that motion, you can use it both as, again, something to use throughout the day to help with your daily activities and kind of getting down to picking something up and doing something, or putting something on a low shelf or something like that. And it can also be progressed and used as an exercise in the foam roller or assistive device. Whatever you're using can be helpful for both of those situations.